Good afternoon, everyone. I am here with our nursing instructor, Michelle Rogers, for another college and career conversation. And as you can see, we are in one of the simulation labs. Now, Michelle, I see you have your gloves on right now. I see a bunch of things that I don't know because I'm not a nurse. Tell us, what are you going to demonstrate to us right now?
Well, I would like to demonstrate how to perform an IM injection. And so with patients, we do give IM injections, and we have to administer medications according to the physicians and what the patients need. And so one of the vaccines that I'm going to give is a pneumonia vaccine. And so we're going to demonstrate that today.
And this is something, the flu is something students learn in class, right? Different sicknesses and illnesses and diseases.
Yes, you will learn so much in nursing. You'll have to learn how to tend to the patient, to assess the patient, and in order to perform your nursing interventions, you will have a plan in place. And when you have a plan in place, we want the patients, of course, to be healthy. And for them to be healthy, we need to provide care to them. And so one of the things that we do perform is medication administration. So I'm going to demonstrate that for you today. And of course, we always clean the vial.
Now, while you're preparing to administer this injection, talk to us about exciting careers in nursing. We know the health field is very vast, and there are different types of nurses.
It is. And so with nursing, you can go in so many areas. You can work on med-surg. You can work in a surgery floor if you prefer to work with surgical patients. You can work in a cardiac floor as well as needed for the patients should they have cardiac problems. But nursing is never boring. Nursing, you can work as a charge nurse, you can work as a nurse manager, you can also work as a case manager where you're talking to the patients and making sure that they have all the care that they need in order to go home. Of course, again, we want our patients to be as healthy as possible.
So every day is different.
It is. It's never boring.
I love a career
Never
like
boring.
that.
Yes, yes. And that's one of the joys that I've had as well is with nursing. It's never been boring. You can work in a variety of departments. You can learn so much from your patients when you talk and engage with your patients. And then this is one of our mannequins. It's a high fidelity mannequin. And we can demonstrate different skills with students. And with that, we want to be sure to engage the students and have real life scenarios. And by having real life scenarios that we can engage the student in how to appropriately care to the patient as needed. And because it is real life situations that we pose to you so that you know how to react to a given situation based on the patient's needs.
What can students expect when they enter the nursing program? And I see Jacqueline Fletcher. Jacqueline, if you have any questions you'd like to ask to our nursing instructor, Michelle Rogers, I encourage you to type your question below, and we'll love to answer that right here live on Facebook.
Absolutely. But with expectations with nursing school, it is very challenging at first and through the program because we are dealing with patients' lives. And with that being said, you have to know a wide range of care to provide to patients, whether it's COPD, other respiratory problems, or it could be something, maybe say for instance, cancer. You have to know a wide range of information in order to provide care to the patients. So we're excited about nursing. Nursing is where you also get to know the patients very well and communicating with the patients, and you get to know them on a personal level. And that's always nice and rewarding.
So Jacqueline has a really good question, Michelle. Jacqueline just asked, how can she prepare or practice good study habits?
Well, that's a wonderful question. With study habits, it is entirely different in the nursing program and compared to history or your sciences that you take where it's knowledge based. And so with the nursing type of questions, it is a higher level of thinking with Bloom's taxonomy. Not only are we trying to understand and take in the information that's available in our books, but able to apply it in a given situation. And so when you come into the nursing program, we do offer ATI as regarding test taking techniques and study techniques as well.
Do you suggest students creating flashcards for different vocabulary? What are some things that our current students do that can help Miss Jacqueline?
Well, flashcards worked wonderfully. Also, having a group study, individuals that you work as a group and study for preparing for tests. And it is challenging, but always look at different types of question, because nursing questions is very detailed. Again, you're able to take the knowledge that you have gained through your studying, but you're able to apply it to a given situation. So a lot of our nursing questions is where we are having a situation or a scenario, and you would take that information that you have for the knowledge and be able to apply it to that scenario.
Jacqueline said thank you.
Yes, it's wonderful.
I have one more question for you. What is it like working in the medical field?
In the medical field, well, it's all very exciting. As I mentioned earlier, it's never boring with the care that we provide. Well, you may want to or would like to work in trauma, such as ER, and that's always a fast-paced area. Or you may want to work ICU as well, and that's also another fast-paced area. And so again, it's constantly changing. You have a wide variety of patients to take care of, and all of them are very unique with their needs and the care that we provide. So there's many areas that you can work in as a nurse.
I see that Stephanie Marie Heel is on the Facebook watch right now. Hey, Stephanie, if you have any questions personally, feel free to drop your questions in the comments, and we can have our nursing instructor, Michelle Rogers, answer those questions for you. So, Michelle, I'm curious to know, what inspired you to step into the nursing field? This is a personal question.
That is a personal question. I love it because I want to comfort people. I want to comfort the individuals in the way I provide care, and to provide them guidance in which ways to they can provide better care for themselves, because a lot of times with patients, they do not know how to take care of themselves once they go home. And so I like to educate them, make sure that they're well informed and have all the information at discharge, making sure that they maybe, if they need oxygen, make sure that they have oxygen at home, have a wheelchair, maybe have home health set up. And so just making sure that they have the guidance that is needed. And so I just love patients and getting to know them on a personal basis and providing excellent care to the patients so that they can live a healthy life.
And we want to say thank you all for tuning in to our college and career conversation with our nursing instructor, Michelle Rogers.